My name is Leigh Faight. I'm the Director of Coaching with ACT Dental, and I want to share with you a practice inspiration. When I first began in dental hygiene about 10 years ago, one of the things that I had the opportunity to explore very early on in my career was a chance to sit down with a dear friend and mentor who was also my boss to learn about the type of dentistry that he did. And we didn't just talk about it. One of the things that he was so awesome about is that he would, midway through his restorative appointment, he would pop up and invite me to come in and look at his work, mid-prep, pre-prep, and even post-prep, so that I would begin to understand not just what was going on in the disease and the restorative process, but that I would also be able to understand the technology he used and why we used it. And so that was fantastic for me because the end result for me in my hygiene chair was that I built a level of confidence in having conversations with patients about restorative process. So what I want to share with you today is how do we bring our entire team together and calibrate on our treatment philosophy and our treatment planning approach so that we can gain confidence with not only our team, which is extremely important, but our patients, and that our message across from front to back and back to front is consistent. So you're familiar with the term calibration. We did it in clinical dentistry, and I did it in hygiene, right? My job as a hygienist when I was a student was to make sure that to the left of me and to the right of me, my student hygiene clinicians were calibrated with me. So we're familiar with the term. And what clinical calibration is really no different. We're ensuring accuracy and commitment and alignment of our treatment philosophy. So when I use the term clinical calibration, it's pretty basic, right? It's taking our entire team, sitting down around the table and making sure that our language, that our message, that our consistency in conversation with patients is there and present. So we don't create confusion. It's a really common pain point when I go to practices. One of the first things that teams say to me is, I wish my doctor didn't spend so much time in my operatory. I wish my doctor wouldn't repeat the things that I've already said. And what I know is sort of a pop-up for me is we're not on the same page about our restorative process. So we work with teams all over the country. I've been on hundreds of visits, and this is probably one of the most fundamental, important processes that we put in place. And it's really simple and straightforward. So I want to go through that with you so you can have the steps in place and begin to implement this together as a team. So I want to go through a few steps, and it's really one of the most important things I can tell you about clinical calibration exercise, or sometimes we call it treatment planning summit, is this. Commit to a time interval and commit to starting on time. It is critical that if we're going to take time out of our day to sit down around the table as a whole team and communicate about our restorative process, that we use that time really effectively. Okay, so that is an absolute have to. The number one rule in business is that we start on time. And this is a pain point for many dentists who have meeting madness, or Patrick Lencioni wrote a great book about death by meeting, right? We don't have an agenda, we don't start on time, and they're not effective. So if you're going to commit to this, you have to start on time, and we have to use an agenda. And it doesn't have to be complex. The greatest piece about these clinical calibration exercises is that they can be really simple and straightforward. So I've just got a couple steps and tips to go through. So number one, everybody on the team attends. The misconception with clinical calibration is that it's a clinical team. Not true at all. The whole team attends. One tip I'd give you about your team, your entire team attending, is that large teams sometimes require smaller breakouts to do this exercise effectively. The reason for that is typically that sometimes there's some big energy in the room among teams, some voices that show up louder than others. And in small group breakouts, there is safety in smaller numbers. So I really like to see large teams break out into more pods. It allows more flexibility in communication and allows some of those softer voices to be able to show up and be heard. And what we're doing in this calibration exercise is trying to get our entire team to give voice to where they get stuck in our treatment planning conversations, where they get stuck in talking about our restorative processes. So that's an invitation for you to analyze and kind of assess your own team and say, is that true in my team? And if so, small groups would be a great idea. The next thing that you need to be prepared for is to make sure that we come to the table to this meeting. It's a critical time. We're securing about an hour, I tell teams, out of our normal day. So we want to make sure we're productive. So we need to bring all the tools that we believe would be helpful for this exercise. Some of the things that I ask teams to bring, one is any information about a new patient. If we decide we're going to do the exercise around a new patient, then I need things like the new patient call slip. I need pre-assessment information. So during my hygiene assessment, what information did I gather? I need things like images, radiographs, potentially even models. So this information that I'm collecting and bringing to this clinical calibration exercise is essentially all the things that I use to create a treatment plan. Now, it's not relevant whether we've had this conversation yet with patients, whether we've sat down and gone over a treatment plan. The purpose of the exercise is for our team to get familiar with the language we use, to get familiar with why we chose this restorative process over this restorative process. It's not about getting it right. It's about asking the questions that we wouldn't want to ask in front of the patients. So it's imperative that we bring to the table all the tools that we believe are most useful in creating a comprehensive treatment plan, even if that plan has already been created. Because again, what we're doing is bringing our admin team, our assisting team, our hygiene team, and our doctors together to get on the same page about those conversations we're having with patients. So make sure you have all that information present. One of the things that I recommend practices do is that they identify one leader for this treatment planning summit that will bring that information. Each clinical calibration exercise or treatment planning summit ends with us deciding what is it that we're going to talk about next time. And so that meeting leader would then pull all of the information we're seeking for these calibration exercises and have it planned and prepared and ready to go once we sit down. That's imperative, because if we don't show up ready for these meetings, again, we're going to go back to meetings don't work. They're not the best use of our time. Another great tip that I will often have teams do is create a list of forbidden words or common words. It's really helpful for teams to get not so much scripted on the language we're using in these calibration exercises, but get clear on what are the words that we use that are most helpful for patients, and what are the words that we want to minimize using or even forbid ourselves from using. I have teams that even have some fun with this, and every time they hear one of these forbidden words, they drop a coin in a jar, and eventually they either have a boatload of money for a pizza party, or they maybe even donate it to a great cause. It's really a fun way to help us collect the language that we want to be using and start to minimize the conversations and language that we don't want to be using. So create a list of commonly used words and forbidden words. And then finally, commit to a routine. One of the recommendations we make is, especially in the beginning when teams are doing these exercises, that they do it frequently enough that we are not, when teams, I'll stop and say this, when teams are starting to do meetings and they're new, they're clunky, they're messy. This is true for any organization. And you'll probably experience this also with clinical calibration exercise. Don't dismiss the idea that the beginning of meetings, and even for a little while, meetings will be messy and they will feel unstructured. And this is why I'm identifying a few important points that you must bring to the table when you're doing these exercises. So let them be messy, but also commit to doing them often enough that you'll find a healthy rhythm and a pattern to these meetings. That's critical for us feeling, A, that they are valuable, and B, that we're getting out of them what we need, which is building confidence among our team that we are a very strong restorative partnership as a team, and that each person within our team feels confident to talk about the message of our restorative philosophy. And that is my practice inspiration.